Hi everyone, today I'm here with clinical psychologist Simon Tamanis, and I'm just going to ask him a little bit about what he does in the therapy room as a psychologist and how he helps people.
Hi Angelica, hello everybody.
So let's get started. Can you describe, Simon, a little bit about your job and the people you help and the illnesses?
So I've been a psychologist for 14 years coming on, and in private practice now for 12 years. So I guess there are different types of psychologists. I work as a clinical psychologist, so I help people with mental health issues specifically, but I also help people with general day-to-day life issues like stresses to do with work, to do with family, to do with their relationships, their friends, their studies, their school. And I also work with people with what we call, diagnosable conditions like anxiety disorders, social phobia, maybe OCD, maybe depression, people with strange delusional thoughts like psychosis, and other symptoms that go with that. So it's a real mix. Sometimes it might be drug and alcohol issues. I guess people choose to cope with their difficult thoughts and feelings by using substances like alcohol or marijuana or cocaine, or they might have gambling issues as well. They might be coping with their stress through gambling or pornography or things like that.
Okay. Yeah. And can I ask what is involved in these sessions?
So when we first get a phone call from a person who would like help, one of our client liaison officers, i.e. yourself or Sue downstairs, will answer the phone and ask a few questions about what the person is struggling with, what they want help with, what their goals of therapy are. So from that, we'll sit down as a team and we'll make sure that the right psychologist in the practice is actually seeing the client, and then with the right skills and experience and training. And then the client will come in for their first session and we will try and understand what's going on for the client. So we'll do a thorough, what we call clinical assessment, which is taking a history of their family life, their upbringing, a little bit about what they're struggling with at the moment, what's difficult in their life, and a little bit of the sort of psychological symptoms that are showing up for them, as if there's symptoms of depression, anxiety, stress, things like that. And we really want to get to know the person as a person separate from their psychological issues, so we can, I guess, form what we call a therapeutic relationship where that person can start to trust that I'm there to help them, I'm there to care about them, and I'm there to help understand their issues better with them, and then apply what we call psychological treatments. That is, I guess, a way of helping the person to manage their issues better, to reduce their psychological symptoms, whether it's depression, anxiety, stress, or maybe their drug and alcohol stuff. We also work on them improving their satisfaction with life, and we help people connect with their values, things that they find really matter to them, how they want to be as people, what they want to get out of their lives. And we kind of do a little bit of a discussion about, are you acting and taking action towards those things or away from those things, to help the person start to, I guess, commit to actions in line with their values a bit more. We know that helps reduce psychological symptoms and improves their satisfaction with life.
And what are some of the psychological tools and methods you might use in helping someone with a mental illness?
So there are lots of different psychological models of therapy. In fact, there's over 170 odd, that was the last time I looked, which was 10 years ago. There was over 170 recognized models of therapy, psychological therapy, counseling. So we use what we call evidence-based therapies, things that have lots of research data with hundreds of thousands of people, sometimes maybe just 100 or 200 people, that show that these methods or psychological skills or models work to help people to achieve their goals of therapy or reduce their symptoms. So just three models, quite a few models I work with. One is called schema therapy, one is called acceptance and commitment therapy, another one is called cognitive behavioral therapy, and compassion focused therapy is another. So we, I guess, teach people how to notice and be aware of thoughts and feelings. And the relationship we have with those can really affect our mental health if we get all caught up in them and they push us around, and we lose contact with the present moment. These can be quite unhelpful. So helping clients to notice when they're caught up in them, whether they're gently making room for those difficult thoughts and feelings, able to hold them, or if they're trying to push them away or get rid of them, that is another unhelpful process. We want clients to work towards being able to gently make room for their difficult thoughts and feelings, like anxiety or pain, sadness, anger, guilt, rather than trying to push it away, definitely not being too caught up in it.
Yeah.
We also help people, I guess, set goals and make committed actions towards what really matters to them. And within the room, we also give a lot of feedback on what we call a dynamic process, which is what is happening between the therapist and the client within the relationship and in the room. So we might pick up on certain things the clients do in the room and help them be aware of that, so that they can reflect on that and think about whether that is working for them or not working for them outside the room in their life, in their other relationships.
Cool. And I suppose nowadays there's much more acceptance and acknowledgement of mental illness within society. You know, there's the Mental Health Month and Are You OK Day, for example. Can you discuss your views about this? Is it helping? Is it positive?
Good question, Angelica. I guess historically mental health has had a lot of stigma about it. And stigma, I think, means a lack of understanding and unhelpful judgments about it. So any information for people in the community about mental health is helpful, as long as that information truly reflects things about mental health. So Are You OK Day, Mental Health Awareness Week, social media, posting things about mental health helps people to become more educated and informed, and reduces the stigma or those unhelpful judgments which don't really give greater understanding to mental health. So I think social media has a big role to play, and the media at large, of helping the community to understand more about mental health. And I guess that's partly why we've started shooting videos and putting them on our work Facebook page to help educate the community. And we're also, I guess, providing videos with psychological skills so that people can start to understand what happens in the therapy room. And I guess this video today is another example of us trying to let the community, let people out there in the population know that psychological therapy is, although it may seem like a scary thing, is a really helpful, quite a normal thing actually these days that a lot of people are engaging in. So all these awareness weeks, months, social media, I think is very, very helpful if used in the right way.
Definitely. Okay. That's it for today, Simon. Thanks for your help, your knowledge.
Thank you for your great questions, Angelica. It's been a pleasure for me. I hope some of that content has been helpful for you out there. Bye for now.